Hi, everybody. It's Dr. Kengia here, and we are back with a chat with him about health information management. And I am here today with Mr. Linzy Hayes. Hi, Lindsay.
Hey, Dr. Kenji.
How are you?
I'm doing all right. And yourself?
I'm doing well. Thank you for asking. Tell us where you're from.
Originally from Miami, Florida, and
Okay.
so I relocated to Tallahassee once I completed my degree in HIM.
Did you go to FAM too?
Yes, I went to went to FAM
Okay.
along
All
with.
right. All right. So we're going to jump straight into our questions. So, question number one, let's start with the why. Why did you choose HIM?
I chose HIM and HIM chose me. I chose HIM basically. I was presented with an opportunity to shadow different healthcare professionals. So I shadowed a pharmacist, shadowed a nurse, shadowed some administrative staff and some directors,
Mhm.
and I just felt like HIM was that perfect niche for me.
Okay. Okay. And at that time, did you have any experience working at all? How did you determine, were you looking at everything, clinical, non-clinical? Were you
At the,
open?
I was open because at the time I was a biology student.
Okay.
Had a few more courses to complete. Definitely looking for something on just looking, trying to explore more opportunities and see what was out there. And I just remember sitting with the HIM director at the time. I was shadowing at the University of Miami, and definitely I had a great experience shadowing with her. It was a great
Oh, that's
opportunity,
wonderful.
and I definitely felt like this is my niche.
Okay. All right. So, okay. So how did you land your first job in the field? Or
I
what was
land,
that first job?
my first job, I was a health information management clerk, so a HIM clerk at
Hmm.
basically HCA Capital Hospital here in Tallahassee. I landed
Okay.
that job based on my internship. First, I was a student intern, and then my director, he just liked my enthusiasm and just my eagerness to learn. So, my internship was relatively short. I felt like I wanted a little more. So he was just like, "Hey, I have a nighttime clerk position. Would you like to apply for the position and join our team? Everyone here likes you and everything." So that's how I landed my first role through an internship.
Okay, so before I jump to the next question, tell me a little bit about that nighttime role because I don't think most people understand that depending on how large the facility is, there will be multiple shifts. So, what
Uh,
did it look like being a clerk on the night shift?
Being a clerk on a night shift, it started at 5 p.m. and you would leave at 1 a.m. So basically, after all the patients, typically patients discharge around the last patient may discharge around 5, um, no later than 7 p.m. So I would collect charts twice on my shift. Just collect all the discharge charts, bring them to the medical records department. I would uh I would prep them, scan them, get them ready for them to be uploaded into our systems, electronic health record, our EHR system.
And before the courier came, right?
Before the carrier came, yeah, definitely you had to get them out before 1 a.m. Had to have them ready for the carrier before 1 a.m. Yeah, you sound like you're familiar with the process.
Look, I worked for an HCA facility. I know how that process goes.
Uh, Definitely. Because we no longer use the carriers. Everything is scanned in house now. So,
Okay, so you're still with them.
yes, I'm still with ACA.
Okay, all right.
Yeah.
All
I
right. So the next question, the what? What has the journey been like for you? So how long has it been since that first position?
It's been 4 years since that first position. A
Okay.
little over 4 years since I graduated and started my first HIM role position. And then from that,
Okay. So what has it been like over these past 4 years?
it's been pretty good. I would definitely experience a lot of highs, and then a lot of highs. I mean, it's been pretty good. I would say for me at least. Um, as that while I was so I landed the clerk position, and then I left my full-time position. I had a state job where I was working with inmates with the
Oh,
state
wow.
Department
Okay.
of Agriculture, and I was kind of leading like an inmate work camp where you know, I would get inmates and kind of, I wouldn't say check them out, but I would pick them up from their institution, and then I would
Hmm.
bring them into like the state, different state buildings, and we would do different assignments. They needed different labor assignments.
That
So
sounds like a cool job.
it was pretty cool. Definitely, I learned a lot. Just working
Okay.
with the inmates and stuff. Definitely learned a lot. A lot of smart guys. Just they
Hmm.
made a few wrong decisions, but
Right, right. So
yeah,
this is very different for you.
yeah, very different. Definitely. So I transitioned from that job into a job at ACA, and in that role, I would redact different I redact like what was it? I redact man, my mind is like going, but
Oh, that's okay.
I would redact summaries, surveys,
Okay.
patient, yeah.
Okay.
And then I transitioned from that role into the HIM management position at Select Specialty Hospital, which is a long-term acute care facility here. And they're pretty much they're all over the nation, but we have one here in Tallahassee. So I was a
Okay.
HIM manager, a credentialing manager there.
Okay. So that is that what you're
Yeah.
doing now?
No, currently right now I'm a manager in training. So
Oh,
I'm just
okay. All
yeah.
right. So you've explored several things.
Yes, definitely. Kind of have my feet
Okay.
in
So
like
tell me a little bit about this manager in training.
the manager and training position. I feel like is a great opportunity for any new graduate or any young, HIM professional. I have the experience of just rotating to different parts, just different fields within HIM, as far as just collections. I had a chance to, you know, work with the facility privacy officer within the hospital. So any type of HIPAA breaches and stuff like that, I was hands-on with that. I got just a hands-on opportunity to work with the release of information process. And
And you're going to different facilities too, right?
right, I'm getting a
Okay.
chance to just explore different facilities. I even had the opportunity to explore facilities in Georgia. So just to see how
Okay.
the differences between states, how they do things in Georgia compared to how, they do things here in Florida.
Okay. I love that. And I think when we post this, I want to post a link because I really think that this is one of the best opportunities for up and coming HIM professionals.
Right.
And I know Paralon gets a lot of applications, but I think it's a great way to get your foot in the door for that HIM director position for sure.
I think so as well. Definitely. And just learning different management styles, I thought that was great as well, just to see how, different managers get the best out of their staff.
Hmm. So tell us, what kind of manager are you, Lindsay?
The type of manager I am, I try to lead with integrity. I try to
Okay. I love
just
that.
thank you. I try to lead by example. Definitely when, just when I'm asking my staff to do something, just let them know, hey, I wouldn't have you do anything I wouldn't do myself.
That's right.
And
Hmm.
definitely try to lead with compassion. And that's just kind of the
Look, what
leader I
book are
am.
you reading, Lindsay? Because you're saying all the right answers.
No, that's just how I am, man. That's just, my mom's a social worker. So, a lot of that
Oh,
stuff,
see?
yeah,
Okay.
a
My
lot of that,
mom was too.
yeah.
Hmm.
So I learned a lot of that stuff from her, man. Definitely.
Okay. All right. So, question four, the where. So, where do you want your career in HIM to take you?
Honestly, I just wanted to take me, I just want to be in a position just to help others, others.
Okay.
I'm very passionate about the field. So, as I bring other people into the field or, anybody coming behind me, I just want to just be that example, just be somebody who can pull others up within the field. Definitely, I'm always available. Like, if you see me on LinkedIn, man, just feel free to reach out to me. So kind of what I want to do in my career, just facilitate, others with getting them to where they trying to go.
Right, right. I love that, assisting. Well, that's a perfect segue into our very last question. Advice. So, as you know, HIM is a female dominated industry, right? So,
Right.
what advice would you give other men looking to start or to transition into this profession?
If you're looking to start or transition into this profession, I would definitely say get a head start on just networking. That's
Hmm.
something I kind of struggle with. I don't know if it was just being from Miami. Like me and another guy, we joke about, we'll joke about that. Like, yeah, we're from Miami. So we kind of, I wouldn't say standoffish, but we just kind of like, just keep to ourselves. But I would say definitely get a head start on networking. Don't be ashamed to, or don't be afraid to network. I would,
Right. So, how do you, how and in what way? Right?
uh,
LinkedIn, are you going to conferences? Are you
definitely.
calling up those other manager and trainees or those HIM directors at other facilities?
So my approach, honestly, man, I'm not afraid to, I mean, I slide in your DMs, you know what I'm saying? If
Okay.
you, uh,
Okay.
what I'm saying, I'll jump in direct message you. So that's kind
Right.
of, that's kind of how I am. Hey, how do I go about doing this? Hey, can you listen to me interview or just different things like that? I always try to glean any advice I can from people who are
Hmm.
already doing what I'm trying to do. And what I
Right.
found out the most, I mean, most people are willing and wanting to help. They definitely want to
Right.
usher. They definitely want to be, just a part of your growth and say, hey, I helped that person come along. So that's what I'm finding out. And that's kind of how I want to do it. So definitely to any male out there, definitely, also invest in yourself. And with the RHIA, if you see any type of training out there, get the extra training, invest in that, invest
Okay.
in.
So, question for you. Let's talk a little bit about it. When did you get certified?
I got certified the day before I graduated from my HIM program. So I took
Okay.
this
So, you did early testing.
took the test before I graduated. So the information was
Okay.
was fresh in my mind. So
That's
I
right. Hmm.
definitely don't wait too long to take it. The sooner
Yep,
the
I tell
better.
people that all the time. Don't, try and take it within that first 6 months of graduating, but we know life happens
Right.
and sometimes they can't. So when they can't, like you said, invest, take those refresher courses, invest the time, not just the money, right? Buckle
The
down,
time.
invest that time.
Definitely. I even constructed I had a little schedule I put together for myself. Just trying to put man, I was serious and I felt like I was
Right.
hungry. I was just hungry. I mean, at the
That's
time,
how it should be though.
definitely keeping that hunger, that fire burning. And I would say,
Okay. So do you see yourself earning any others?
definitely, I want to earn some more certifications. Definitely want to have some alphabets behind my name. So
Okay. All
uh,
right.
currently, I'm currently in the MBA program, and I'll be wrapping that up in May of 2023. So
Okay, all right. Congratulations. That's soon.
pre
That time will be here before you know it.
right, it's only 5 months away, so that's kind of what's on my agenda is for goals as well. Just finishing up that program.
Okay. And then by then you should be in a director's role, right?
Yeah, I should be a director. Before you know it, I should be a director. There's some things in the mix, so I'm just waiting for everything to come into
Okay.
fruition. So,
All right. Well, don't forget about us here. And please keep us posted.
definitely will keep you posted. And one more, just one more advice I would say, is invest in a nice suit or whatever, to the young men
Yes.
out there.
Great
Uh,
advice.
definitely.
Okay. All right. Yes, that is great advice. Yes, suit, nice shirt, nice tie. Right?
Right.
Yes,
Yes.
absolutely. Well, thank you so much for your time this evening. We really appreciate it.
Thank you.
All right. And to learn more about the qualified and what we do, visit us online at www.the-qualified.com. Thank you for watching. All right.